Hi everyone, welcome to Endocast. I'm Dr. Tuğçe Apaydın. Today we are recording live from Endobridge 2024. Right now, I am with Dr. Charlotte Höybye and we will talk about Prader-Willi Syndrome. Thanks for accepting our invitation and thanks for being with us today, Dr. Höybye.
Thank you so much for giving me the opportunity to talk about Prader-Willi syndrome. I have been working with this group of patients since many years, and I'm seeing adults with Prader-Willi syndrome. And I think it is a very interesting group of patients and in great need of not help, but possibilities for treatment of all the issues that they have.
Okay, could you a little bit mention about in which cases we should think about Prader-Willi syndrome?
In an adult, I think you should think about it in a person with uncontrolled eating. They have this hyperphagia, which is dysregulation in appetite and satiety regulation. So they cannot stop. Most of them have difficulties in stopping or feeling that they have eaten enough so that they feel the satiety. So this is a big problem for most of them, and it really affects their daily life and possibilities to, for example, have a work or joining the society in complete. Yes.
Could you mention also other components of our syndrome?
Yeah, so they have also growth hormone deficiency, and this is why I, as an endocrinologist, is interested in the syndrome. And so it's approved for treatment of the children, but when they get adult or the growth has finished, then they need to test again if they have a growth hormone deficiency. And most of them have and can continue treatment. And I think it's good for them as adults because it affects metabolism and it affects also the body composition. They have, if they are not on treatment, then they have a low muscle mass or small muscle mass, but very much subcutaneous fat. And this balance can be changed so it gets more normal or normal. So this is good for them, I think, and they also get more alert. Most of them are also they easily get tired, so it can also make them be more alert and have a better physical activity. So I think it's important.
What are the main indications for recombinant growth hormone therapy in these patients?
It will be that they have a growth hormone deficiency, and they should have it because usually we think that they have an affection of the hypothalamus, and with that, the growth hormone deficiency. So this would be, but otherwise in treatments, there are not that many treatments for them. They are not 100% of them, but the vast majority are on a very strict diet, and they have to be supervised and controlled. And in most cases, the refrigerator and cupboards and with food, and the freezer has to be locked. Otherwise, they cannot control this drive to eat.
Do you prefer medical treatments for obesity in patients with Prader-Willi syndrome, or can we use GLP-1 analogs to help manage their cravings?
We don't know exactly about the GLP-1 analogs. They're only small studies, and some have effect, but it is usually combined with continuing the strict diet and physical activity, as they all have. And in many cases, it will not have much effect, and maybe it's because everybody hopes that they do not need to be this super control of what they are doing and what they are eating, but it has to continue, at least as far as we can see now. So we are not finished with this we will have to see if larger studies will show something else.
Okay, thanks a lot. I would like to ask about hypogonadism in these patients. Would you like to mention a little bit about this one?
Yes, this is the most common endocrine deficiency syndrome. It's a hypogonadism. So it's very frequent, and I think it should be treated because it changes their appearance. So they look more adult. So if you have a hypogonadism that you have had since childhood, then you look like a child in many ways. So to make them more their appearance to be more like a grown up, then I think it's important. And of course, it's also important for the skeleton and for being a man and a woman and for the body, because the sex hormones also have metabolic consequences. So I think it's important to treat them, but some cannot be treated because they have it affects their temper. Yeah. So, but for those of them where it's possible, I think it's an important treatment.
You also have some publications about osteoporosis in these patients and also some kidney complications and also malignancy. Would you like to mention a little bit about this kind of stuff?
Yes, for the malignancies, we did not see any increased rate. It's difficult to say if it's because we are looking at a cohort that's quite young or what it is, but we couldn't see that it was increased. But of course they can get cancer, and I think the most important thing that we could see from the study was that we have to be aware that they can get cancer like anybody else, and they have to follow the screening programs of the country that they live in. And for the osteoporosis, it is probably also connected to the hypogonadism not being treated, I would guess.
If we summarize this for our colleagues, can we say we should consider Prader-Willi syndrome in cases involving obesity, hypogonadism, and growth hormone deficiency?
They have an intellectual dysfunction, so this is also characteristic for the syndrome, and it's not much, but it is maybe enough for them not to be able to live by themselves. And also this, it is like autism, but it's not autism, but the need for very foreseeable way of living, so they know exactly what would happen. Then they best for them, they feel best. But it's a multi-symptomatic syndrome, so they have a lot of symptoms. I'm happy to be here.
Thanks a lot.
Some experience.
Thank you.
Thank you.
We really appreciate your time for sparing time for us. Thanks a lot.
Thank you.
And that's all for today's episode of Endocast, and we will continue exploring important topics from Endobridge. See you in the next episode.